Let's continue for September 2023, the question number 120 onwards. 23-year-old asthmatic man is admitted with a bilateral fracture of the fibula and tibia. Followed a road traffic accident. He is on 15 mg prednisolone daily, undergo surgery. Which of the following regimes? So here person is getting more than 10 mg. It is so reduce on the day of surgery. No increase the steroid on day of surgery and followed. D is the answer. A patient in road traffic presented with a fracture of ribs 5 and 6. 3 days later, they suffered from dyspnea, tachycardia. Blood pressure is 170 by 90, sweating and poor air entry, normal sounds. Road traffic accident, fracture of ribs 5th and 6th, suffered dyspnea, tachycardia. Tachycardia, it means entry without abnormal sounds. Poor air entry without abnormal sound, most likely diagnosis. Fracture of the ribs if there, air entry is poor, blood pressure is raised, tachycardia is there, 70, sweating and poor air entry without abnormal sounds. So it has to be fracture ribs, analgesia is poor, that's why a person is getting tachycardia and dyspnea. A is the answer because there is no pneumothorax, no embolism, pneumonia, COPD, this will not happen. Ineffective analgesia. Suggest pulmonary common complication following trauma, especially rib fracture that might cause pulmonary contusion. ARDS following severe pulmonary trauma, but it is usually present with severe refractory hypoxemia. A is the answer. It is not pulmonary embolism. 23-year-old patient, weight 50 kg, had scalp wound, prepared for suturing lignocaine. Local anesthesia, lignocaine 1% and adrenaline. What is maximum dose? 50 into 7 divided by 10, 35 ml. Now next question is 50-year-old man is undergoing cancer removal surgery for sigmoid. What should be considered according to enhanced recovery? Early removal of nasogastric tube. 70-year man is receiving blood transfusion following multiple hematomases. Within first hour of transfusion, he feels unwell. Which one of the following is delayed complication? Delayed is jaundice. Delayed reaction to hemolysis from incompatible blood transfusion. 75-year man scheduled for abdominal periodization carcinoma of rectum was given carbohydrate drink the night before as part enhanced recovery. Does preoperative loading improve surgical outcomes? What is the reason? That is negative nitrogen balance has to be improved. C. 22-year woman receives intravenous morphine for acute abdominal pain. Which of the following best explains analgesic properties? It binds mu receptors. So opioid receptors within CNS, for peripheral nerve, no, it is in the central receptors. E, it is 4, that is mu. Lock the pathway. 18 kg child maintenance fluid post-operatively. Post-operative, what is the amount of saline needed for a child per hour? It is up to 100 ml per. I think it is around. So you have to calculate per hour. Normal saline, (1800) divided by 24, 30, 300 by 4, 75 or something, but 56. How is the formula? 4 into 10, okay. 4 into 10, 2 into 10, 40. 4 ml for first, then 2 ml for next, 16 and 40, it is 56. So 56 is the answer. So this is the formula. 100 ml for first 10 kg. So it is either 100 or 4 to 1. Normal saline. Maintenance is normal saline. For child, maintenance is normal saline. For adult, maintenance is 1 liter normal saline and 2 liters or 1.5 liter glucose. For resuscitation of the child, it is 20 ml per kg saline. So this is not resuscitation, this is maintenance. For neonates, 10% dextrose. 50-year-old man complains of recent onset diplopia. On examination is unable to look inward and downward. So this is the action of SO4, superior oblique, supplied by superior oblique. 48-year male has squamous cell carcinoma, outer canthus of the eye, lymphatic drainage of outer canthus of the eye. Outer canthus is very close to preauricular and inner canthus is going to submandibular, I think. Outer canthus, like lateral part of the eyelid, goes to preauricular lymph node. 45-year man suffered from the disc prolapse and prepared for physiotherapy on his back. Which muscle is primarily targeted during physiotherapy? Disc prolapse, back muscle, I think erector spinae muscles. These are strong. Disc prolapse target is erector spinae to strengthen the spine, alleviate back pain. For 70-year smoker, ulcer on the lateral border of the tongue. Lymphatic drainage is submandibular. And lateral border of the tongue, whether it is ipsilateral or bilateral deep submandibular, contralateral submandibular, bilateral submandibular is also there. So lateral border ipsilateral. If suppose it is in the middle, then it has to be 20-year-old man presents with pain when brushing his teeth. Which nerve is likely to be affected? Foramina. When brushing his teeth, lower teeth and lower jaw. Mental mandibular branch. There has to be mandibular branch of trigeminal nerve via foramen oval. D. Mental nerve which is coming from the mandibular branch. Exit to the skull foramen oval, then it comes out. Patient develop gustatory sweating, males like mechanism. Which is likely mechanism? This is auriculotemporal, parasympathetic nerves of auriculotemporal nerve. Regeneration of parasympathetic fibers of auriculotemporal nerve into differentiation between upper motor and lower motor. Differentiation between upper motor neuron and lower motor facial can be assessed by raising eyebrows. Squeeze the eyes or close them. This is another thing, but raising eyebrow is basically for differentiation. Forearm muscle responding for raising eyebrows are spared due to bilateral cortical input from lower motor effect. Entire face including forehead. Okay. Patient after alleged trauma to the occipital cortex suffered. Now occipital cortex injury is there, suffered from the loss of vision. Which vessel is most likely affected? Posteriorly, posterior inferior cerebellar, pica is for cerebellum. Posterior cerebellar may be there. So this is about supranuclear palsy. So upper motor paralysis of contralateral face, lower motor paralysis of ipsilateral face. Lower motor is the same side of face, upper and lower, by parotid tumor, acoustic neuroma, facial fracture base. To differentiate, elevate upper eyebrow, not eyelid. So in this side, eyebrows can be lifted on this. Lower motor is on the same side. Upper motor is the opposite side. This is important. Contralateral. Posterior cerebral artery, which is responsible for vision ischemia in area, can lead to visual defects. During arch autography, vertebral artery would be seen to directly arise from which of the subclavian? Now, subclavian artery, there are two parts. First part, second part, third part. Third part. It is from the first part of subclavian. This is very important and good figure. This is subclavian artery. This is first part. First vessel is vertebral going above. Second vessel is thyrocervical. Third is internal thoracic, also called as internal mammary. Second part gives costocervical trunk. We forget this. And third part gives dorsal scapular, and it continues into axillary. This is important again. Arch of aorta, right side there is brachiocephalic, left side subclavian is independent, common carotid is independent. And with CD vertebral, internal mammary, thyrocervical, with CD, C costocervical, dorsal scapular. One only. From second part 1, third part 1. This is with CD. This is very important. You just see the circle of Willis. Common carotid arteries. A beautiful figure, common carotid arising from the innominate on the right side independently from the left side, dividing into external and internal. Internal carotid is laterally initially, external is medially. Then the vertebral arteries are going from below, center from the subclavian. They are forming the basilar artery. External is totally out. Internal is going inside as the internal carotid artery. Then it is giving middle and anterior cerebral artery. Here is internal carotid giving middle and anterior and vertebral artery. They are forming the circle of Willis. Typically arises from the first part of subclavian before it ascends to foramen transversum cervical vertebra. This prolapse occurs due to deficiency in which structure? Annulus prolapse is nucleus pulposus and deficiency is annulus fibrosis. Annulus fibrosis outer ring of the disc degeneration rupture can lead to herniation of the nucleus pulposus, commonly known as disc prolapse. 60-year man presents to emergency department epistaxis. Source of bleeding is identified little area. Got which vessel? Sphenopalatine. Everyone is telling sphenopalatine. Sphenopalatine. Lateral area or Kesselbach's area is a common site for epistaxis supplied by anterior ethmoidal artery, among them vessels. Okay, anterior ethmoidal is there. Presents with headache, vomiting, deterioration for last 2 weeks. On examination, he has papilledema. CT scan shows space occupying lesion in the right parietal lobe. So in right parietal lobe there is SOL. On examination, he has papilledema. Right parietal space. On examination, papilledema CT shows space on the right parietal develops sudden homonymous hemianopia. Bitemporal is different tunnel vision. Homonymous hemianopia means same eye totally. Which part of the visual? It is optic radiation. maybe optic radiation, because if you see caused by lesion in the optic tract or optic radiation. Parietal lobe lesion likely compress optic radiation leading to visual defect. This is the picture. So one is the optic nerve, so single eye. 3 is optic chiasma, bitemporal. 2 is just right side nasal. Homonymous. 4th is optic tract. Homonymous hemianopia, same sided. 4th. Now 5th, 6th, 7th. 7th is homonymous hemianopia due to lesion of right occipital area. Occipital area is just like optic tract. 5th and 6th is inferior and superior. The questions are not there. Occipital cortex and optic tract is near about similar. So this question was space occupied lesion right parietal lobe develops homonymous hemianopia, which so maybe optic radiation, and if suppose occipital area is there, it will be same. Forty-year male after head injury has lost ability to comprehend and process the language. Processor is gone means it is vernix, and output is gone means Broca's. Lost comprehend. Okay. Which nerve is affected with submandibular gland excision lead to asymmetric smile? It is marginal mandibular, giving asymmetrical smile. Marginal mandible is a branch of facial nerve innervates the muscle of lower lip. Damage during mandibular surgery result in asymmetrical smile. 40-year male is present with injury to the angle of mandible. So there is injury to angle of mandible. Damage the deranged movement during biting. Muscle is responsible. Angle of mandible. Medial pterygoid, it is supplied. So presence with injury to the angle of mandible. Where is the attachment? So lateral pterygoid is involved in opening the jaw and moving side to side. Injury to the muscle causes difficulty in jaw movement. So this is lateral pterygoid, and angle of the mandible is medial pterygoid. That's what mandible angle is medial, and lateral pterygoid is near the temporomandibular joint. So angle of mandible is medial. Lateral pterygoid is involved in opening the jaw. It is side to side. Injury to muscle causes difficulty in jaw movement. This is true, but it is not attached at the angle of mandible. "50-year-old presented with epistaxis from superior nasal septum. Which artery is affected?" Now this is nasal septum. That's why it is anterethmoidal. Specifically asked about superior. Which layer of the scalp moves easily? Loose areolar rotation. Over the periosteum. Which layer of the scalp allows it to move easily over the periosteum? It is loose areolar tissue. So D was upper part, anterior ethmoidal artery. C is loose areolar tissue. Referred to as danger area of the scalp because it allows scalp to move freely and limit spread of infections. 23-year-old man after root accident is compromised and requires tracheostomy. Which of the listed structure is likely to be injured during the procedure? Third is the li- least likely the sitting pharyngeal. Platysma is also there, but it is in the center. Platysma explanation on platysma is superficial muscle neck and lies above the structure at risk in tracheostomy and least likely to be injured compared to deeper structure like recurrent injury. When taking a sample, match the problems to last structure that you go through. Last structure, pleural tap, visceral pleura, no. Abdominocentesis, visceral peritoneum, no. Lumbar puncture, subarachnoid, this is true. Myocardium, no. Renal biopsy, parietal peritoneum, no. Lumbar puncture. So what about this? Let us see. These are the two things. Kesselbeck's plexus is anterior epistaxis. Woodruff's plexus is posterior epistaxis. So this is two. Superior epistaxis, anterior posterior ethmoidal. Woodruff's is less common and often seen older due to hypertension is phenopalatine. Kesselbeck's little most commonly in children and younger common is phenopalatine. And superior epistaxis is anterior. So this is about facial artery anterior ethmoidal. Posterior part of the lateral nasal wall, inferior to inferior turbinate. Typically most profuse lateral origin. Typically more serious nosebleed. Below can nasal contributing arteries, phenopalatine lateral phalangeal, ascending pharyngeal sometimes mentioned. When taking a sample, match the procedure to the last structure that you go through. Now we have done it. Patients with the head injury with decrease in GCS 13 to 8 with lucid interval, X middle meningeal. 32-year man with the cook by profession, history of road traffic accident and signs and symptoms. Signs and symptoms of intracranial pressure. It was found to have dilatation of pupil on the site of injury. What is likely a reason for pupillary dilatation? 148, 169. 32-year man, cook by profession, presents with a history of road traffic accident, signs and symptoms of intracranial pressure. He was found to have dilatation of pupil on the site of injury. What is likely pupillary dilatation? Mm, 32-year man, a cook by profession, presents with history of road traffic accident and signs and symptoms of increased intracranial pressure. Pupil on the site of injury. What is likely reason of pupillary dilatation? Overstimulation, parasympathetic, lack of sympathetic, unopposed. Dilatation is unopposed sympathetic. 20-year man presenting with a head injury with decrease in GCS and 13 to 18 with lucid interval in between. The artery most likely damaged in the branch is maxillary, branch of maxillary. Child with unilateral cleft palate and left high risk of ear infection due to deformity of which muscle? Now, what is the muscle that may lead? Most of the time we think of stapedius, but here levator palati can be there. Levator. This is the muscle of eustachian tube. What a beautiful picture, middle ear cavity, auditory canal. levator palate. Palate is elevated. Elevation of the palate. Levator palate. Levator palate muscle is a crucial opening eustachian tube. Dysfunction due to cleft palate can lead to eustachian tube. 1 month old with the bottle feeding presence with the projectile non-bilious vomiting is 1 month old non-bilious non-distant abdomen, pyloric stenosis, pyloromyotomy. First of all IV fluids, then pyloromyotomy. 1 year child presents with clear yellow fluid from the umbilicus. Yellow fluid means patent urachus. Neonate is known to have sacral hemivertebra. Hemivertebra is due to defect in growth of which of the embryonic structure? Now vertebra, this is bone. Notochord, nucleus pulposus, neural tube, spinal cord. Vertebra most probably from the ecto or mesoderm. Okay. This is mesoderm. Hemivertebra is caused by abnormal development of mesoderm which leads to incomplete formation of site. Neonate presents with central cyanosis. Which of the following abnormalities are related to unequal division of conus? Central cyanosis, conus means it is the heart. Unequal division will lead to central cyanosis, transposition of great aorta, or Fallott's tetralogy is more important. Cyanotic at birth, transposition in great arteries. Adult cyanotic born, cyanotic at birth, VSD, adult. Okay. This is the cardiac tetralogy. This is important figure. Aortica, truncus arteriosus develops into ascending aorta and pulmonary trunk. Conus cordis, the green part is rough and that is atrium. And the sinus venosus, one is coronary sinus and smooth part of right atrium. So seventh, if remains, it forms tetralogy of Fallot. 4 things are there: overriding of aorta, right ventricular hypertrophy, means aorta has shifted, come into this, and overriding of aorta, pulmonary stenosis, right ventricular hypertrophy, and ventricular septal defect. Pulmonary stenosis, right ventricular hypertrophy, overriding aorta, VSD. Five-year child with umbilical hernia has 2 centimeter defect. What is the management? You have to wait. 2 centimeter defect means you have to wait 12 months. 2 centimeter defect is not required. 5-year child is there. That's why you have to go. Okay, it is not 5 months. 5-year child. So D is absorbable suture repair. Yes, you can wait up to 3 years. 1.5 child with easily reducible umbilical hernia presents to the clinic. What is the best treatment? 1.5 reassurance. Child has a cleft palate from which embryological origin? Palate is first arch. So these are the arches. 8-year-old with a fatigue after playing present with a harsh continuous murmur, second left clavicle. What is? PDA is harsh murmur on the second clavicle. 7-year-old boy present with abdominal bloody stool diagnosed with Meckel's diverticulum with ectopic tissue, found Meckel's gastric and pancreatic. 60-year-old boy with Meckel's diverticulum presents with abdominal pain and bloody stool. What is the blood supply of Meckel's diverticulum? White low intestinal, superior mesenteric artery. Wet, wetline intestinal duct connects to yolk sac to which part of the gut? Midgut. 7-year child presents with scrotal pain for 6 hours eating chocolate. Urgent exploration. Newborn shortly after birth is noted to have dyspnea, cyanosis, X-ray shows left-sided chest compartment and a gas-full herniation of pleuroperitoneal. There is tumor on the proximal part of urachus on top of the bladder. It is adeno. What is the embryological origin of foramen ovale, septum primum? The body of urinary bladder is derived from urinary bladder. This is urinary bladder body, primitive urogenital sinus. Body of urinary bladder develops from urogenital sinus, also gives rise to urethra and part of genital system. Patient perfect found to have abdominal free fluid in the lower abdominal during surgery. In which space will fluid collect? This is hepatorenal pouch. What is the content of keratin which is like during cystic artery? 27-year man is having stereotactic frame, skull to the neurosurgery, posterior occipital artery. Ulcer on the medial malleus, painless skin change on the ankle, history of varicose vein, PPI. What is most accepted cause of the ulcer? Venous. So I'll stop this here.